Hello everyone, welcome to this video. I have planned to explain the anatomy of muscles of the upper limb as well as the lower limb, and here is my first video where I have explained the muscle anatomy, which includes the origin, insertion, action as well as the nerve supply of major 5 muscles of the upper limb. So let's get into the video. Deltoid muscles anatomy. As the name suggests, deltoid is derived from a Greek word which denotes the sign delta, which is triangular in shape. Similarly, the muscle is also triangular in shape with the base upward as well as the apex downward. So deltoid muscle consists of 3 fibers: anterior fibers, middle as well as the posterior fibers. Anterior fibers is getting originated from the lateral 1/3 of the clavicle. Middle fibers is getting originated from the acromion process, and the posterior fibers are getting originated from the spine of the scapula. So can you see the muscle is in triangular shape? So similarly, the apex of the triangle is downward, which is the insertion point of the muscle. That's the deltoid tuberosity. So the muscle is getting originated in 3 places, but it is getting inserted in a single place called as the deltoid tuberosity. It is getting supplied by the axillary nerve with the root value C5, which is the major root value. It is also innervated by some fibers of C6, but the major root value is C5 and it is supplied by the axillary nerve. Coming to the action of deltoid muscle, as I said you already, it consists of 3 fibers. The anterior fibers is responsible for the flexion of arm at the glenohumeral joint and also for the medial rotation of the arm at glenohumeral joint. The middle fibers of the deltoid is responsible for the abduction of the arm at glenohumeral joint. And the posterior fibers of the deltoid is responsible for the extension of arm at the glenohumeral joint and lateral rotation of the arm at the glenohumeral joint. Coming to the next muscle, Coracobrachialis. As the name suggests, coraco represents the coracoid process of scapula and brachialis represents the brachium, that's the arm. So the muscle is getting originated from the coracoid process of the scapula and it's getting inserted in the brachium, that is the arm. It's getting inserted in the middle half of the medial aspect of the shaft of the humerus, so which represents the arm. So I repeat, it's getting inserted in the middle half of the medial aspect of the shaft of the humerus, and it's getting supplied by the musculocutaneous nerve with the root value C5, C6 and C7. And coming to the action of coracobrachialis muscle, it's helping in the flexion of arm at the glenohumeral joint. It also helps in the adduction of the arm at glenohumeral joint. So the major action is flexion as well as the adduction of the arm at glenohumeral joint. Coming to the next muscle, pectoralis major. Pectoralis indicates the chest and major indicates large, which indicates that there is also a smaller muscle in the chest called as the pectoralis minor. So a large muscle located in the chest, and that's called as the pectoralis major. So it's getting originated from the medial aspect of the clavicle. So I said you already, anterior fibers of the deltoid, it's getting originated from the lateral 1/3 of the clavicle, and medial aspect it is for the pectoralis major. It is also getting originated from the sternum as well as from the 1 to 7 costal cartilages of the ribs 1 to 7, and it's also getting inserted in the lateral lip of the bicipital groove of the humerus. So I repeat, it's getting originated from the medial aspect of the clavicle, sternum, costal cartilages of the rib 1 to 7, and it's getting inserted in the lateral lip of the bicipital groove of humerus, and it's innervated by the medial as well as the lateral pectoral nerve with the root value C5, C6, C7, C8 and T1. Coming to the action of pectoralis major, it helps in the adduction of arm at the glenohumeral joint. It helps in the flexion as well as extension of the arm at glenohumeral joint. It also helps in the medial rotation of the arm at glenohumeral joint. So it helps in the adduction, medial rotation, flexion as well as extension of the arm at glenohumeral joint. And the next important muscle of the upper limb, that's the latissimus dorsi. Latissimus in the sense wide and dorsi in the sense back. So the wider muscle of the back, that's called as latissimus dorsi. It is getting originated from the spinous process of the vertebrae T7 to L5. I repeat, spinous process of the vertebrae T7 to L5, posterior aspect of the sacrum, posterior iliac crest, thoracolumbar fascia, from the inferior angle of the scapula, and it is getting inserted in the intertubercular sulcus, that is near to the medial lip of the bicipital groove of the humerus. So I repeat, Latissimus dorsi, it's getting originated from the spinous processes of vertebrae T7 to L5, posterior aspect of the sacrum, posterior iliac crest, thoracolumbar fascia, and inferior angle of the scapula, and it is getting inserted in the intertubercular sulcus, which is near to the medial lip of the bicipital groove of the humerus. So this wider back muscle is innervated by the thoracodorsal nerve with the root value C6, C7 as well as C8, where C7 is the major root value. And similar to the pectoralis major, latissimus dorsi also helps in the adduction of arm at the glenohumeral joint. It also helps in medial rotation of the arm as well as extension of the arm at glenohumeral joint. And coming to teres major, teres represents round and major represents large. So it is a larger round muscle. Hence we have a smaller round muscle called as teres minor. So teres major is a larger round muscle, and it's getting originated from the inferior angle of the scapula as well as infrolateral aspect of the scapula, and it is getting inserted in the medial lip of the bicipital groove of humerus. Hence we call latissimus dorsi as a lady between two major, because it is present between the pectoralis major as well as the teres major. So we call latissimus dorsi as a lady between two major. So I repeat, teres major, it's getting originated from inferior angle as well as infrolateral aspect of scapula and getting inserted in the medial lip of bicipital groove of the humerus. It is innervated by the lower subscapular nerve with the root value C5, C6 as well as C7. And similar to latissimus dorsi, it also helps in the extension of arm at the glenohumeral joint. It also helps in the adduction of the arm at glenohumeral joint. And it helps for the medial rotation of the arm at glenohumeral joint. So I'll give an overview of all these 5 muscles. Deltoid is a triangular muscle. Coracobrachialis is getting originated from the coracoid process and getting inserted in the brachium, hence called as coracobrachialis. Pectoralis muscle is a major chest muscle, hence it's called as a pectoralis major because it's even larger. And latissimus dorsi is a wider muscle of the back, and teres major is a larger round muscle. Thank you so much for watching the entire video. Please do like, share and subscribe. Thank you so much for watching.